Hey guys, welcome back to my channel. It has been way too long since I sat down and updated you guys on what has been going on. I had every intention of updating you much sooner than this, but here we are. I am finally able to share with you what has been going on recently and what our plan with fertility treatments and everything is moving forward. So in the last update I had for you guys, I let you know that I was waiting for my first appointment with my new fertility doctor, and I had my consultation with them. I think it was the end of February, maybe it was early March, somewhere around there. About a month ago is when I had my first appointment with my new doctor. And that appointment went really well. Considering where I was, it went really well. I absolutely love my new clinic, and it makes me so sad that we aren't going to be here for very long and I won't be able to go through treatments with them because they're just amazing. My doctor and his entire staff are just so kind and they genuinely care. I don't feel like another patient to them. I don't feel like a number. I feel like they genuinely care about me and they care about finding answers for us. And that is so refreshing to be in a place where the doctors and the entire staff just genuinely care. And not to say that my last clinic was horrible, because they weren't, but looking back on it, there were certainly some red flags with my old clinic, and yeah, maybe I'll get into some of that later. But had my first appointment, and basically my new doctor and his nurse practitioner sat down with me and they went through all of my medical records, my medical history from even before we started seeing a fertility specialist, and they went through all of my fertility records, blood work, ultrasounds, everything. They were very, very thorough and asked a ton of questions, of course. Basically, there were some things that were brought up at that appointment from my doctor as far as concerns go, and the big concern being endometriosis. And I don't think I've really talked about this a lot on my channel just because I don't know if I have endometriosis, and the only way to diagnose endo is through surgery. I actually brought this up to my previous clinic, the theory of me possibly having endo, and they brushed it off and told me not to worry about it, and that even if I did have endo, there was nothing that could be done about it, which, looking back on that, should have been a red flag, but I trusted them and just went with everything that they recommended for me. And I can't go back and change anything, but I can only move forward from here. So previous doctor was not concerned about endo, and my new doctor is very concerned about it. Excuse me, allergies are going crazy today because it's like complete pollen apocalypse here in Florida right now. So excuse the frog in my throat. I definitely have some symptoms of endo, but have never been diagnosed. It has always been at the back of my mind if I have it or not, and if endometriosis has played a factor into our infertility journey. And I'm just at the point where I need to know. I need to know if I have endo or if I don't. And my doctor's biggest recommendation for me right now is to have surgery. So I'm here to let you guys know that I have decided to have the surgery, and I will be having the surgery done in about a month. In very early May is when I will be going in for the surgery. So my doctor is going to be doing 3 procedures at that time. One being, of course, the laparoscopy to check for endometriosis. And at the same time, he will also do a hysteroscopy to take a look inside my uterus. He'll be looking for uterine polyps, and he also said he'll be doing an endometrial biopsy, which I guess is just a biopsy of my uterine tissue or endometrial lining. I think, I'm not too clear about that, but he's doing the biopsy, the hysteroscopy, and the laparoscopy all at the same time. So I'm feeling nervous about it. Just the thought of surgery and being put under anesthesia is nerve-wracking. Of course, I don't know anyone who wouldn't be nervous before going into a surgery, but I have had a laparoscopy done before. About 10 years ago, I had to have emergency surgery to remove my appendix, and that was done via a laparoscopy. So I am not completely foreign to surgery recovery. I've also had my tonsils removed. So it's not my first time ever having surgery, but I'm still a little nervous. And if I'm being completely honest, my biggest concern right now is not the surgery, but my biggest concern is coming out of the surgery to be told that they couldn't find anything wrong with me. And I know that sounds crazy. I feel crazy saying that, but maybe if you have gone through infertility and have been diagnosed with unexplained infertility, you may totally get where I'm coming from. But I've said this so many times, and you're probably tired of hearing me say this, but I just want some answers. I want an explanation. And it's so hard for me not having a reason why, because without having a reason why, it's difficult to come up with a proper treatment plan for us because they don't really know what's wrong. And if I have this surgery and they find endo, or they find, something abnormal within my uterus during the hysteroscopy, I can at least give us some answers and insight into what has been going on. And yeah, I'm just terrified of going through this and hearing again how everything is normal, everything looks good. I'm so tired of hearing that I'm just praying this surgery gives us some answers. I will certainly be bringing you all along with me during this whole entire process. I'll be probably filming a few videos before my surgery, just updating you guys on how I'm feeling and how I'm preparing for the surgery. And then it is my plan to record the day of surgery and my recovery after as well. So make sure you are subscribed so you don't miss any of my updates. Aside from the concern with endometriosis, my doctor also had a few other concerns, one being my thyroid. At my last clinic, if you aren't aware, they had put me on thyroid medication because my TSH levels were a little high, so they wanted that number to go down. So they put me on thyroid medication, which I actually stopped taking it because I ran out of my prescription and I haven't gone back to refill it. I know that's terrible, but I did bring it up to my new fertility doctor, and he told me to not worry about it for now, and that he wanted to recheck my thyroid along with thyroid antibodies to see what has changed with that. And I may or may not be put back on the medication depending on the results of that. So he was concerned about my thyroid, and then he mentioned that my AMH level, which is the anti-Mullerian hormone, I'm not sure if I'm pronouncing that correctly, but the AMH levels, it's a blood test, and I guess it shows or gives insight into your egg count or egg quantity. And he said that the last time I had that done back in November, that it was on the borderline of being low, which my previous clinic never mentioned that to me. So that was a little surprising for me to hear. And he wanted to recheck my levels to see if it's changed at all. So this cycle that I'm in currently, they have just been monitoring me. We are not going through any fertility treatments right now since I'm awaiting surgery. But they've just been doing a monitoring cycle. So I've been going into the clinic for blood work and ultrasounds, and they are just trying to get an overall picture and a baseline for where I'm at as far as hormone levels and all of that stuff goes. Since the last time I had monitoring done was our IUI cycle that we did back in November. So I did have my thyroid levels checked. They also rechecked the AMH level. I have not spoken to my doctor about the results, but I did receive those results from the lab, and I'm a little confused about it. So I have an appointment with him actually at the end of this month before my surgery to go over everything, to go over all my test results and surgery prep and all of that. So I'm definitely going to talk to him about it. But my AMH level was completely different than it was in November. So I don't know if one of the tests was a lab error. I don't think levels can vary that much from cycle to cycle unless I am completely mistaken, but it was a completely higher number. So I'm interested to see what he has to say about that. And I, of course, will update you guys once I have more information about all of that. The plan moving forward, obviously, is for me to have the surgery done. After the surgery, treatment from there obviously depends on what they find in the surgery, if anything. So my doctor had mentioned the plan, assuming there are no serious complications or anything that they find in the surgery, assuming everything's okay, his plan for me would be to try a couple rounds of timed intercourse with letrozole. He told me to never go on Clomid again because of the reaction I had with the ovarian cysts that I had. He said the clinic that he works in, the entire clinic never uses Clomid. They just don't like it. They don't think it's that effective considering the side effects that you can have from it. So he said if I did proceed with timed intercourse in the future, it would be with letrozole. So that's kind of the tentative plan right now. But like I said, that's all dependent on what they find while they are performing the laparoscopy and how the hysteroscopy goes and all of that. So I'm trying not to think too far out as far as what the next step is for treatment. I am just trying to focus on the surgery aspect of everything and prepare for that. I think that's pretty much all of the updates I have for you. I wanted to update you guys sooner about all of this because I have known for about a month or so now that the surgery was coming up, but it wasn't actually until yesterday that we got the insurance approval and got the surgery scheduled. And then I'm working right now, so I needed to give my work notice because I won't be returning to work after the surgery because we are moving again. For those of you who don't know, my husband's in the military and we've been moving a lot the last couple of years, but this next move is going to be the last move for at least 3 or 4 years. So I'm looking forward to that, but yeah, I won't be returning to work after my surgery just because I need time to recover, and then we'll be moving again. If you have had a laparoscopy done and you have any advice for me, please leave your comments in the comment section down below. I would greatly appreciate any advice or tips you have for me as far as preparing for the surgery or helping myself recover afterwards. Thinking about the last time I had a laparoscopy done, I know the main thing that helped me was drinking a lot of water and getting up and walking frequently. Even though it was painful, I remember just trying to walk as much as I could, not overdoing it, but I just remember getting up every so often and walking around really helped me get back on my feet. Literally, it helped me get back on my feet sooner. And I don't remember having a hard time recovering from that procedure. I think with my appendicitis, I was in so much pain before the surgery that the pain I felt after the surgery was actually significantly less. So it's been about 10 years since I had my appendix removed, so I may recover differently now, but I'm hoping I won't have a hard time with it. And yeah, I appreciate you guys. Please leave me a comment down below with updates on how you're doing. I've missed uploading videos, and I am promising you I'm going to start uploading more regularly, especially with everything going that we have going on in the coming months. So yeah, thank you so much for watching. I will see you in my next video very, very soon. Bye.